think it was quite an exciting conference. Just specifically regarding the kidney cancer space, I think two trials come to mind, one of which is actually, I would say, quite relevant to our abstract, and that's the results of the PAPMET trial presented by Monty Powell from City of Hope. And this was a phase 2 randomized trial looking at the efficacy of different targeted agents in papillary RCC. And ultimately, the trial came down to a comparison of Cabozantinib versus Sunitinib. And, based on the results presented, ASCO, the Cabozantinib appeared to have an improvement in PFS compared to Sunitinib. So I think this is really exciting. This is probably the highest level of data we have in papillary renal cell carcinoma in terms of having prospective randomized data showing that Cabozantinib appears to be superior to Sunitinib in that space. The second trial would be, I think, the CLEAR trial, which, as I think you're well aware, was a large phase 3 trial comparing another immune checkpoint inhibitor combination to standard Sunitinib. This trial looked at the combination of Pembrolizumab with Lenvatinib compared to Sunitinib, and also included a third arm looking at Lenvatinib and Everolimus. And I think the key takeaway was that the Pembrolizumab Lenvatinib combination appeared to have improved survival compared to Sunitinib. And again, this was just somewhat similar to other trials like the KEYNOTE-426 trial looking at Pembrolizumab and Axitinib, and really, I think, reinforces that a combination of an immune checkpoint inhibitor with a target agent is quite an effective option in metastatic clear cell RCC.